Hello, my name is Amber Woolman. Every summer, I experience being around a lot of wildfire smoke. And although I hear about how it can affect your physical health, I've never really heard how it can affect your mental health as well. In Washington this year, through the month of August, we had over 1,000 wildfires. Each of these wildfires is releasing smoke that is very harmful for your physical and mental health. The reason I chose to explore this topic is because, like many, I've heard how wildfire smoke can be very harmful for your lungs and your respiratory system. But I've never heard someone bring up how it can affect your mental health in ways like anxiety, depression, lack of motivation, and even suicide rates. Anxiety is one of the mental health factors that are affected by wildfire smoke. In a study, a healthcare provider noticed that many people were coming in for unnecessary medical testing due to their anxiety during this time. And not just that, but anxiety can also stem from people being worried about when the fire is going to go away and if their families will be okay. Depression is another mental health factor that is extremely affected by the exposure to wildfire smoke. Much of this stems from isolation from staying inside to protect your physical health, not knowing that that can be detrimental to your mental health. Some of the depressive symptoms from wildfire smoke are accelerated from previous symptoms, while most of the depressive symptoms are from social isolation during this time. Due to the wildfires, it is very common for people to want to stay inside during this time to avoid the physical hazards. But this leaves people feeling very down and dull with no motivation to do anything. Among rural populations, there was a study conducted to see if there's a correlation between suicide rates and the air pollution from wildfire smoke, and there was. The following chart provides a visual aid of the monthly suicide rate along with the annual smoke exposure in the country. The next graph shows the slope and rise of suicide rates in rural residents on smoke days. These effects can range in severity. They can also affect certain groups more than others. Like people with previous mental health conditions may be affected easier. This is important to know so when wildfire season rolls around again, we are prepared and can prevent some of these effects. It is important to stay inside so you can stay physically healthy, but knowing that this can lead to depressive symptoms is important so that you can also make time for social interaction as well. Educating communities about the mental health risks associated with wildfire smoke can lead to more proactive coping strategies. Some symptoms that show that your mental health may be affected include irritability, difficulty concentrating, restlessness, fatigue, and even headaches. Children, along with elderly, are more vulnerable to these effects, along with people with previous mental health conditions. Some ways to lessen these effects on your mental health would be to talk to a mental health professional, whether that's in person or online, as well as staying connected with your friends, family, and loved ones during these times. Spreading awareness about the dangers of wildfire smoke on mental health is very important so that people can be prepared and educated. I hope through this presentation you were able to learn the different mental health factors affected by wildfire smoke exposure, why it is important to know about it, and what we can do to prevent it in the future. Thank you for watching.